So, welcome to Talking Women's Health podcast, where we have candid conversations with amazing leaders in OB-GYN. I'm Dr. Amy Young. I'm the CEO of ABOG. And today our topic is clarifying the role of key organizations for OB-GYN as a specialty: the American Board of Obstetrics and Gynecology, the American College of Obstetricians and Gynecologists, and the ACGME, the Accreditation Council for Graduate Medical Education. My guests today are two incredible leaders in our field, Dr. Sandra Brooks and Dr. Meredith Alston. Dr. Brooks serves as the CEO of the American College of Obstetricians and Gynecologists, and she has more than 60,000 members. She is celebrating her first anniversary at ACOG, and prior to joining ACOG, Dr. Brooks was the Chief Medical Officer at hospitals and health systems across 4 states. She has a history of leadership in the House of Medicine and within OB-GYN. So Dr. Alston is currently the chair for Women's and Infants Department at St. Joseph's Hospital. She is also the Enterprise Designated Institutional Official for Intermountain Health, and she's representing the ACGME, or the OB-GYN Review Committee, today. And she has been the chair of that committee for approximately a year, and she has served on the committee since 2021. So welcome, guys, to the podcast today, and thanks so much for joining me. This is our first virtual show, so I really appreciate you really helping us out today. So I think the first and most compelling topic that we're going to talk about today and help with our audience is to have them gain a better understanding of each of the roles that our institutions that we represent play in the House of Medicine of OB-GYN. There's obviously some natural connections that tie our organizations together where we have opportunity to collaborate, but we all serve the specialty really in distinctly different ways, and hopefully we can clarify that for our audience. So I'd like to start with Dr. Brooks. Sandra, can you talk a little bit about, from your perspective, the roles that the American College of Obstetricians and Gynecologists plays in the OB-GYN House of Medicine?
Certainly, and thank you again for having me on your inaugural podcast. I think if I had to describe ACOG's role in the specialty, it's that we are first and foremost a membership organization. We're the largest professional organization for OB-GYNs in the United States, and our focus is really on building strong community, supporting, guiding, and advocating for our members throughout their careers. We're committed to supporting our members through every step of their professional journey, like from the time they're baby doctors as students in training through establishment of their careers and beyond. And through the educational and clinical guidance that we provide, we work to promote evidence-based, inclusive care for our members and the patients they serve. And we work with thousands of dedicated volunteers that collaborate with the staff to develop the guidance that we all depend on. And we publish this work on our website, in our Green Journal, Obstetrics and Gynecology, which is a trusted resource since 1953. Our educational resources, CME opportunities, and events help our members stay current with our evolving specialty. Additional key elements really vital to our work include our commitment to advocacy and equity. Every year, we convene hundreds of OB-GYNs from across the country to provide key updates on legislative priorities and provide tactics for effective discussions with legislators. And this is called our CLC, or Congressional Leadership Conference. We then deploy those teams to meet with leaders on the Hill, and then they also use those techniques and tactics when they go back to their hometowns. It's really an effective way of really galvanizing the budding and early career and later career folks and bringing everyone together for a common cause. We also support development of health policies on issues such as maternal mortality, Medicaid and Medicare access, and the protection of the patient-physician relationship. Our Committee on Health Economics and Coding works to ensure that OB-GYNs get paid fairly. And we all know this is really a challenge that we have to work continually on. And we develop trusted and accessible patient education materials to empower our patients with reliable information. Really, given that misinformation is so rampant, this is really vitally important. And we recognize too that our members are facing pressures from all sides. And in response to that, we support our members with our well-being delegation. And we're launching a newish initiative that offers curated tools and training to help embed well-being into daily practice. So through all these things and more, we aim to support our members and meet them where they are and help them navigate in today's very complex practice environment to try to shape a healthier, more equitable future for all of our members.
So, Dr. Brooks, thank you so much for that clarity. You know, I'm an actively practicing OB-GYN provider today, and the support and the advocacy that ACOG provides is just essential for us to move the specialty forward. I'd like to shift gears and talk to Dr. Alston for just a minute. Dr. Alston, from your perspective, can you talk a little bit about the role of the review committee and the ACGME in OB-GYN and its role in advancing the specialty?
Yes, absolutely. Thank you, Amy. And thank you so much for inviting me to participate in the podcast today. I'm so delighted to be here. So first of all, I do want to clarify that today I am speaking as Meredith Alston, and I'm not officially serving as a representative of the ACGME. But the ACGME is a physician-run nonprofit organization that oversees the accreditation of residency programs, fellowships, and institutions within the medical specialties in the United States. Each specialty has its own review committee, and that committee oversees the core residency program as well as the subspecialties associated with the core program. So for OB-GYN, we oversee the residency programs as well as the ACGME accredited fellowships of GYN oncology, maternal fetal medicine, reproductive endocrinology and infertility, complex family planning, and urogynecology. And really, we are trying to achieve a high level of training through the accreditation process so that the patients in our community can have the best possible care. I do think that it's worth calling out a couple of the things that we don't do because it can be confusing. What is the role of all of these different organizations? And one thing we don't do is we are not involved in the funding of graduate medical education, not within OB-GYN and not within any other specialty. And another thing that we don't do is that we are not involved in setting workforce limits. So we don't make a determination about how many maternal fetal medicine doctors there should be, how many OB-GYNs there should be. We simply evaluate the program and accredit the program with the end in mind of being, can they train outstanding doctors so that we can take the best care of our patients?
So, Mary, thanks so much. I think that provides a lot of clarity. When I think about this and Dr. Brooks's explanation and your explanation, Dr. Brooks's constituents are really members or future members, and your constituents are really programs at the programmatic level. So I thought I'd provide a little bit of clarity what the American Board of OB-GYN does. So we're a certifying body. And people think about us as just the people that give really the big hard tests that are sort of milestones in our career. But one of the most important things that we do, I think, flank that. One is that we set eligibility standards, and those eligibility standards, I think, influence a lot of the field of OB-GYN specifically. The other thing that we do is that continuing certification is part of our responsibility. We have a parent board, the American Board of Medical Specialties, and there are a set of criteria and rules, if you will, that we follow, and continuing certification is part of that. We're so lucky, for example, to be able to use materials that the American College and other subspecialty organizations create because they really set the standard of care, and we use those instruments that are grounded in evidence and based on science in order to construct our exams in our continuing certification programs. So I think of our constituents as diplomates. That's what we call somebody after board certification, and candidates. So you can see that there's some synergies between our organizations, but we're really different and we're really at arm's length from one another. And so I think understanding our differences, but also the opportunities to collaborate and where we have intersections is important. So thinking about that, Dr. Alston, I'm going to let you go first this time. And I was wondering, what do you think, for example, about your intersection at the ACGME and the review committee with the board and with ACOG? And what does that look like to you? And where do you see those opportunities?
So I do think that we have a unique situation within our specialty that our three organizations are able to come together to address issues. And that isn't always true in all specialties. At the same time, we all do have our specific sort of lane or corner of the world for which we are responsible. As far as how we come together with relationship to ACGME, a great example of that is that on our review committee, we do have ex officio members from both the board and the college that participate in our meetings. Now, they're ex officio members, so they do not participate in discussions related to accreditation or accreditation decisions, but they are present for some of the discord that happens in those meetings. And I think that's really helpful for those organizations to be able to understand the issues affecting our programs and affecting medical education in general. As far as areas where we are collaborating currently, it brings to mind the concept of competency-based medical education. So what we call CBME is really a concept within medical education that focuses with developing curriculum with the end in mind, with a strong focus on assessment and really on ultimately serving the patients. And so sort of building things backwards, if you will. There are other specialties that are further along in this process than we are. And we are learning from those specialties, but we are able to work together between the board and the college and the ACGME to think about how CBME might impact accreditation, how it might impact certification, and ultimately come together with, again, the end in mind as to how our patients can best be served by those trainees that we are producing and putting out into the community.
So, Dr. Alston, thanks so much for that clarification. I definitely think graduate medical education is one of those places where, we collaborate and we really collaborate across all of the organizations. And I think, we're in this transition to competency-based medical education, and it's probably not just about GME. It's probably a lifelong endeavor. And so I want to turn it to Dr. Brooks for just a second. Dr. Brooks, you alluded to this idea that one of the roles that you play within OB-GYN is in residency education. I think that's really through CREOG and their creation of materials and their support of program directors, et cetera. Do you want to piggyback on some of Meredith's comments around either competency-based medical education or just graduate education in general and what ACOG does in that particular space?
Absolutely. And as Dr. Alston was speaking, I made a note to say, commitment to lifelong learning is really, I think, a through line that we all share. I probably would not describe it so much as a lane that we have, but rather we each have our mission, which then drives our actions and how we execute on our mission. And in order to do that, we have to collaborate. And so you're absolutely right. Through the CREOG, the Council on Residency Education in OB-GYN, is really you, aiming to be very innovative in this space of understanding how the next generation of physicians learn differently than the prior generations, and how do we make sure that we're adapting the way we're educating our trainees and providing them the tools, and also providing more objective, less biased ways of assessing how people have received that education, and making certain that when folks are ready to go out there in the world, that they're as prepared as they possibly can be. And so I think, in order to do all that, we have to have those close collaborations and partnerships with ABOG and ACGME, and really a host of other organizations that share that commitment to evidence-based healthcare, and really supporting that through the continuum of practice. Making sure that our trainees and our members in practice are prepared for not only that initial certification, but that ongoing continuing certification. And the other piece is within all that, looking at we recognize that OB-GYNs work very hard. They work all the time, and we want to make certain that we don't place unnecessary burdens, and that to the extent that there are structural burdens that our practitioners face, that we work really to help to alleviate those burdens. So we want to make sure that any products that we develop, or any things that we're doing to try to assist our members, help them to do that in a way that makes sense, is relevant, and is not unnecessarily burdensome. The other piece is that we also collaborate with an alphabet soup of other organizations, from the ACP, AAP, AAFP, APA, which includes the pediatricians, family medicine, internal medicine, and psychiatry, and beyond, osteopathic medicine, to be able to advocate for the hundreds of thousands of physicians that we represent collectively, and the millions of patients that we all represent. And so whether we're working with these advocacy partners to elevate a unified voice on critical policy, or collaborating with our educational partners to really strengthen the learning journey for OB-GYNs, these partnerships are really essential.
Dr. Brooks, thanks so much for your comments. They really resonate with me, specifically this issue of burden. And it's sort of a good segue to the other topic I wanted to discuss with you guys. So the promotion of mastery has been really front and center throughout my career as a medical educator and a leader, within obstetrics and gynecology, and even in medicine itself. And so the promotion of mastery from residency to retirement through certification has been a goal that I brought to the board with me. And so one of the things that is critical is that we have to evolve our processes. It's going to involve the use of technologic advances, not only in the day-to-day care of patients, but really in the way that we interact with our various constituents in order to move the field forward. So, Dr. Brooks, I thought I'd start with you. I'd like to hear from you both about what innovation means for the specialty from your perspective or your vantage point. So, both of you guys have been in your roles for about a year. And what does innovation look like, for example, from the perspective of ACOG or from the ACGME or review committee? So, Dr. Brooks, I might start with you if that's okay.
Certainly, and this is really a very timely question, because we have these discussions all the time, and we're limited by our bandwidth, not our imaginations, about what we love to implement. But I think, it speaks directly to how we think about the future of clinical guidance and how we engage our members. We're really deeply committed to producing that evidence-based, comprehensive content. However, we recognize that people consume that content very differently. The fact that we're on this podcast now, hope some people will see us. Some people might never see us. They might hear us while they're driving to work or as they're doing, the dishes or making dinner, right? So therein lies the opportunity to innovate. Long form articles are really the base of what we do, and from which we identify how we might provide the tools, whether it's an algorithm, a podcast, a social media post, consumer-based material, all in service of making sure we're there when and how our members need us. I think another example is we just launched a new journal called ONG Open, which is an open access journal. It's more nimble, and as the name implies, it's more accessible. It's just 1 year old, and we've exceeded our projections in terms of submissions of research focused on women's health, and being able to provide that in a more expedited way, but still with the same commitment to evidence-based practice and thorough vetting. And I would say we also are looking to innovate with respect to providing well-being resources to support our members. It's really an unfortunate fact that OB-GYNs rank fairly highly among specialties facing unacceptably high rates of burnout. So we really aim to mitigate that through connection, building resilience, peer support, and removing barriers to practice. So that's a really important element that we'd like to bring that, but bring it in a science-based, evidence-backed way that is sustainable. And I think, innovation isn't also just about the application of technology, but it's also, big ideas. One great example is Residency Cast, which is a big idea that uses technology, but also creates a learning community. It's our residency application platform, which was launched this past year, that had 100% of programs participating in a holistic application process that was less expensive and more adaptable. It was a huge lift for our program directors. So really shout out to them who really engaged in this a really grand experiment that was very successful. And we're really really proud to say that OB-GYN is still a very desired specialty. We had 99.9% match rate. And, I'm really happy to say that the next generation is bright, committed, and motivated. And we're really listening to them about what innovations they'd like to see. So that piece also excites me, being around smart, committed people who really want to see us move the specialty forward.
That commitment at OB-GYN, one of the things about this particular role is I get to see that and feel it in a pretty tangible way almost every day. I think it's a real privilege, right? And because it just drives you towards your purpose and your mission in a way that if you didn't have that sort of tangible connection would be difficult. So Meredith, what about, or Dr. Alston, what about with the ACGME? I'm actually privy to a couple of innovations that you guys have been thinking through. Do you want to share some of those with our listeners this morning?
Yeah, thank you so much, Amy. Glad to have that opportunity to talk about some of the things that we are doing. So medical education within our specialty, residency education specifically, has looked pretty much the same for a really long time. And as we've had discussions today about really trying to think about those patients that we serve, seems like we need to be evolving. And I think for a long time, people have felt that we needed to evolve, but we've been a little stuck in how to make that happen. So historically, through the review committee, all residents have been expected to really have equivalent experiences such that they all have the opportunity to achieve competency in all the procedures throughout the depth and breadth of the specialty. However, we are seeing that there are practice changes happening, and there are procedures that remain very important to best serve our community. However, they are becoming less frequently performed, which makes them more difficult to train. And specifically, I'm talking about operative vaginal delivery and vaginal hysterectomy. We also have about a third of our graduates who are going into subspecialty fellowship training. And many of them will never perform those procedures, specifically operative vaginal delivery and vaginal hysterectomy. So we have created what we are calling the Flexible Procedure Experience Pilot, whereby residents who have matched into specific ACGME approved fellowships, where they will not perform those procedures any further, or would be very unlikely to do so, can now finish residency with experience numbers that are lower than the minimum standards for ACGME, and the program will not be cited if those residents are then basically able to share those procedures with their fellow residents, such that the residents who are more likely to actually perform the procedures in practice have access to more procedures. So this is really the first time that we're thinking about how might we include individualization so that we can better train our residents to ultimately be able to perform these really critical procedures in the setting of decreasing volumes.
I see really the same thing in our assessments. I mean, essentially, we've had a written exam and an oral exam called the qualifying exam and certifying exam that really haven't varied very much in construct for over probably 20 plus years since I took them. And so understanding the evolution of assessment and frankly, eligibility criteria and learning to tolerate some flexibility while we have fidelity in our assessments. I mean, we have an obligation to the public to make sure that we're certifying folks, and the folks that we're certifying are safe to take care of people. It's really about creating a workforce and supporting a workforce that's going to serve generations of our OB-GYN patients into the future. I think we all do that really sort of from our perspectives, but this opportunity, I think, and innovation is great. I also am very optimistic. I'm generally optimistic anyway, as you guys know, but I'm optimistic about the opportunity for AI really to address some of that burden that Dr. Brooks talked about and let us spend our time taking care of patients and learning and making sure that we are masters in our area and our field. So with that, we just have a few more minutes, and I wanted to give you each the opportunity to leave some parting thoughts with our audience today. So Dr. Alston, you want to start first?
Sure, Amy. And thank you again so much for including me in today's podcast. It's been wonderful to be here. And I think as I reflect on our conversation today, what I would want viewers to take away is really, what do we each do, right? It can be very confusing. And how do we each of our organizations, how do they serve the OB-GYN community? And when I think about the board, I'm really thinking about the individual certification and then subsequent maintenance of certification and the individual OB-GYN. And when I think about ACOG, I'm really thinking about everyone. I'm thinking about how programs are supported through CREOG, educational materials that are produced. I'm thinking about all of the programming that is available that Dr. Brooks has mentioned to really support OB-GYNs, their practices, sort of across the entire spectrum. And when I think about ACGME, we're really talking about the programs themselves and really trying to ensure outstanding training through the accreditation process so we can best serve our community. And really all of us have that in mind. And it's wonderful to have the opportunity to come together and discuss all of our organizations today. Thank you.
Thanks so much for being here. Dr. Brooks, do you have some parting comments for our audience?
Well, thank you, Dr. Young and Dr. Alston. This has really, truly been a pleasure. I would say that we recognize that the world is extremely complex, and the complexity of practicing medicine in this environment grows almost with each day. The demands of the field continue to grow. It's shaped by the evolving science, policy landscape, and the emotional and physical intensity of the work. And on top of that, our docs are really facing challenges with maintaining a sustainable practice environment because of the administrative burdens or payment structures, legislative interference, on and on. But despite these challenges, our members remain deeply committed to the profession and find joy in the connections we make with their patients and one another. OB-GYN is a field like none other, high tech, low tech, medicine, surgery, all in service of helping women and those requiring OB-GYN care get the care they need. So we, if you had to sum it up, I say we work tirelessly to help our members sustain that joy. And while we may not be able to eliminate every barrier, we are committed to doing as much as possible to make the practice of OB-GYN both rewarding and sustainable. And, I share with you the optimism you have for the future. We see it in the faces of the people we meet every single day. And it is my deep honor to be in this position at this time where we can help to join with them to help them make all things possible to have a thriving professional career.
Well, thank you so much for your comments. I think that wisdom will go far within the specialty. And I'm really grateful that you guys took time out of your busy schedules to be with me today. So this is Amy Young, CEO of ABOG and Talking Women's Health, and we look forward to seeing you next time.